Hi, I'm Anthony and I'm a paramedic, and today I'm going to demonstrate to you how to lift a patient on a scoop stretcher. When we decided to use the scoop stretcher, the first thing we need to do is size the stretcher off the patient. So we size this when the stretcher is together, release the clips, be sure it's long enough from the head to the toe, and then seat the clips back in place. When you're happy that it's long enough, unclip either end of the stretcher. On one side, place it in towards the patient like so. Then place the other side onto the right hand side of the patient like so. Point to remember here is when we're sliding this in, the back of the scoop stretcher may pinch the patient's back. So sometimes it may be beneficial to slightly tilt the patient towards you if sliding under. For the purpose of closing it, I will get my assistant to come in and help me close the stretcher. I'm now going to call in assistants, one to take the head, control of the head, while we do a 15-degree roll to allow the scoop stretcher to be put in place. Can I get your assistants there, guys, please? As always, man at the head will always control the movement.
Raise, roll, and roll. Raise, lower, and lower.
The stretcher will then be clipped in place when that's done on both sides. You may strap the patient onto the scoop stretcher now to ensure safety of the patient.